My name is Savannah Lacey, and today I will be talking about Down syndrome. I'm going to go over what Down syndrome is, the different types of Down syndrome, data and statistics of Down syndrome, the diagnosing of Down syndrome, and some common secondary complications of Down syndrome. So what is Down syndrome? To start off, I would like to introduce Katie. She is my sister-in-law's little sister and one of the most beautiful people I've ever met. Therefore, you will be seeing several photos of her and her development into the beautiful person she is today throughout this presentation. Down syndrome is the result of extra copy of chromosome 21. Some of the most common phenotypic effects include flattened face, almond-shaped eyes, short neck, small ears, tongue that sticks out of the mouth, small hands and feet, single line across the palm of their hand, poor muscle tone and loose joints, and short stature. This gene is expressed immediately. It is not hereditary with the exception of translocation Down syndrome, where it is seen that in 1/3 of cases, one parent has a translocated gene. I will talk about this further in the translocation Down syndrome portion of this presentation. Down syndrome was characterized by Langdon Down in 1866. Langdon did not have Down syndrome himself, however, he did simply correlate all of the phenotypic effects of the syndrome and named it Down syndrome. Jerome Lugin identified the chromosomal condition in 1959 and linked the syndrome to having an extra chromosome 21. To this day, it is unknown the cause of Down syndrome and how many factors play a role in its genetic condition. There are 3 types of Down syndrome. Trisomy 21 Down syndrome is when each cell in the body has 3 separate copies of chromosome 21. This is the most common form of Down syndrome, and there are various levels of IQ and variations of phenotypes associated with this syndrome. Translocation Down syndrome is when an extra part or a whole extra copy of chromosome 21 is attached to a different chromosome rather than the extra chromosome being completely separate. It is typically found attached to chromosome 13, 14, 15, or 22, and in some cases is attached to another copy of chromosome 21. These people have all of the same phenotypic effects as people with trisomy 21. Balanced translocation is the only version of Down syndrome that is hereditary. It is found that one parent will actually have 45 total chromosomes in their cells, however, the parent is completely healthy. Balanced translocation occurs when a person has the rearrangement of a chromosome with no extra or missing chromosomal material. A person with balanced translocation of chromosome 21 will have no phenotypic effects of Down syndrome, but some will have difficulty conceiving, suffer from miscarriages, and have increased chance of having a child with translocation Down syndrome that does have all the same phenotypic effects of Down syndrome. Mosaic Down syndrome is when some cells have 3 copies of chromosome 21 and other cells have the favorable 2 copies of chromosome 21. Some people will have all of the phenotypic effects as people with trisomy 21, and others will have fewer features than trisomy 21 due to many of the cells in their body having the preferred 2 copies of chromosome 21. Overall, people with mosaic Down syndrome typically have a higher IQ. Data and statistics of Down syndrome. Down syndrome affects approximately 6,000 babies in the U.S. This is equivalent to every 1 in 700 babies being born are affected by this syndrome. 95% of these babies have trisomy 21 Down syndrome, 3% have translocation Down syndrome, and 2% have mosaic Down syndrome. This syndrome affects both male and females, and women conceiving after 35 years of age are at higher risk for having a child with this syndrome. Let's look further into how age affects the likelihood of having a child with Down syndrome. Here I have statistics of the age of the mother versus the incidence of Down syndrome as collected by the CDC. For a woman conceiving at age 20, the incidence of Down syndrome is every 1 in 2,000. For women conceiving at age 25, the incidence increases to every 1 in 1,200. For age 30, it is 1 in 900, 1 in 350 for age 35, 1 in 100 at age 40, 1 in 30 at age 45, and 1 in 10 at age 50. The increase of incidence of Down syndrome is due to the mother's older eggs having a greater risk of improper chromosome division. As the mother ages, the eggs age with her, and during the metaphase portion of chromosome division, the spindle fibers do not appropriately attach to the kinetochore, and the sister chromatids are not properly separated, leading to an extra copy of chromosome 21. Life expectancy of Down syndrome. 93% of children born with Down syndrome survive to be 1 year of age. 88% survive past 20 years of age, living on to be, on average, 47 years of age. There are several factors that play into the role of the life expectancy of a child with Down syndrome. One of these factors is a low birth weight, which is noted to be any neonate born under 3.3 pounds. Children with Down syndrome that are born with a low birth weight are 24 times more likely to die before reaching 28 days of age. African American infants have a lower chance of surviving past 1 year, and more research is needed to understand why this is. Infants born with congenital heart defects are 5 times more likely to die before 1 year of age. There is an increasing number of adults with Down syndrome that are becoming able to live independently with minimal assistance, and a small number of those are able to live entirely independent. The diagnosing of Down syndrome. There are several in vitro tests that can be done to diagnose Down syndrome. The two major types are screening tests and diagnostic tests. Maternal blood tests can be done to search for markers in mother's blood. The two markers for Down syndrome are pregnancy-associated plasma protein A and free beta-HCG. An ultrasound can also be done to search for a high level of fluid in the nuchal fold, which is around the baby's neck. This is a typical characteristic of babies born with Down syndrome. And screening tests are highly inaccurate, often show a false positive, and can only accurately show if the mother is at a higher risk for the syndrome. CVS, or chronic villus sampling, is a way to examine placental cells which have the same genetic makeup as the baby. Amniocentesis is another method which involves the insertion of a long needle into the amniotic sac to obtain a sample of fetal cells to evaluate. Percutaneous umbilical blood sampling examines the blood from the umbilical cells, which also contain fetal cells, for evaluation. These diagnostic tests are capable of giving a definitive diagnosis of Down syndrome. However, they are highly risky to the mother and the baby because they are all invasive tests. Once the baby is born, they are diagnosed with Down syndrome based off of their physical attributes and karyotyping if necessary. Secondary risk factors. People born with Down syndrome are at an increased risk for secondary complications. These percentages shown are the increased risk of children with Down syndrome compared to children without Down syndrome. People with Down syndrome have a 70% increase of hearing loss. They have a 50 to 75% increase of obstructive sleep apnea, 50 to 70% increase of ear infections, 60% increase of cataracts. Heart defects from birth are at a 50% increase. Intestinal blockage at birth, typically requiring surgery, is at a 12% increase. Hip dislocation is at 6% increase. Thyroid disease is anywhere from 4 to 18% increase. Anemia with iron deficiency is at a 3% increase, and leukemia in infancy or early childhood is at a 1% increase. Katie Howard is at a 100% risk of capturing your heart with her vibrant personality, her constant optimistic outlook on life, and her huge smile. She is a testament on how strong and capable people with Down syndrome are.